this concludes the college readout. Let me now move to our COVID-19 situation communication ahead of the EU leaders' call on Thursday. We have now reached the point where we can say that the end of the pandemic could be in sight, though not yet in reach. The emergence of new variants of the virus and substantial rises in cases leave no room for complacency. Now, more than ever, there must be a renewed determination for Europe to act together with unity, coordination, and vigilance. Our today's proposals aim to protect more lives and later livelihoods and relieve the burden of already stretched health systems and health workers. This is how the EU will come out of the crisis. We now need a steady and fast pace for vaccinations, and vaccinations is not a race between countries, but a race against time. In Europe, we have opted for safety first. Ahead of this call on Thursday of our leaders, we have grouped in this communication 4 main areas of interest and on which political discussions are now needed. And let me go very quickly through them before the Commissioner presents in more detail the situation as it stands and the communication. These 4 more pressing areas for the leaders to discuss is, of course, the vaccination and the pace of vaccination, the mutation of the virus, the mobility and travel, and international solidarity. Let me first start with vaccination. We need to speed up vaccination and vaccine supplies. To support this, the Commission will work with companies to develop a transparent, a clear delivery schedule of the different vaccines. To ensure an ambitious vaccination effort also entails concrete targets, and that's why we are today proposing that by March this year, Member States should have vaccinated a minimum of 80% of health and social care professionals and 80% of people over 80 years old. We also propose that by summer this year, Member States should have vaccinated a minimum of 70% of the adult population. To be able to meet these objectives, we need to ramp up the supply of vaccines, notably working with manufacturers to maximize, as soon as possible, production capacity in the EU. As more and more people are vaccinated, the documentation and mutual recognition of vaccination certificates becomes of utmost importance. We need vaccination certificates that would allow for a clear record of each individual's vaccination history to ensure the right medical follow-up. A common EU approach to trusted, reliable, and verifiable certificates would allow people to use their records in other member states. It would also open the door to other uses to help lift restrictions. Vaccination certificates will have to be recorded and recognized, and that will be the benefit of all citizens across the European Union. The Commissioner and I, we will continue to work with Member States on this common approach to be agreed before the end of this month and allow Member States interoperable certificates to be rapidly usable within the EU and beyond. Second area of concern is the new variants of the virus. Testing and genome sequencing are essential to identify the progression of the variants or detect new ones, and Member States should update their testing strategies to reflect the new variants and urgently increase genome sequencing at least 5% and preferably to 10% of positive results. At present, many Member States are testing under 1% of the samples. Third, we should preserve the single market and the free movement while addressing mobility challenges. Blanket travel bans and suspension of flights, land transport and water crossings are not justified and are very disruptive. We maintain that any restrictions should be based on epidemiological situations, coordinated, proportionate and non-discriminatory actions. And finally, global solidarity. We have led by example and pioneered an international effort to support vaccines deployment through the COVAX facility, together with our member states, as a Team Europe approach. However, the whole world is now hunting for vaccines, and we cannot just ask partners to wait and see. Today, we are proposing to bridge the gap and create a sharing mechanism that allows vaccination to happen in the EU and elsewhere in parallel. This would require diplomacy and communication efforts so that citizens know that the portfolio we have negotiated allows for more than 1 billion people to be vaccinated, which is much more than we will need in the EU, but also to acknowledge that no one is safe until we are all safe, so it is in our common interest. And our partners, neighbors, and friends should know that Europe and the European Union will support them to that effect. Let me conclude this short introduction here by saying that the coming weeks will represent a great challenge for the European Union. Our vaccine strategy has shown how a common approach can act as our common public health missions and agenda for the coming months take shape in a joint fight, together with our member states and the international organization and partners, to keep the pandemic under control until safe and efficient vaccines are deployed in sufficient scale.